ladies and gentlemen, esteemed speakers and members of European Parliament. This is my great honor to be here at European Parliament with you today and represent Revvity. So Revvity is the global leader in newborn screening. We're providing solutions to over 110 countries. And newborn screening is widely known to be one of the best preventive healthcare systems. And at Revvity, we offer the best-in-class technologies, expertise, and services to newborn screening laboratories around the world. So we as a company, we have a long history in collaborating and partnering with the governments and international health organizations, public and private, to make newborn screening and other public health programs more accessible around the world. And today we are here to call upon policymakers and members of European Parliament to consider implementing type 1 diabetes population-wide screening in Italy and all European member states. So our objective is very clear. We want to assist laboratories in establishing and managing type 1 diabetes screening process from start to finish, meaning from dry blood spot collection to result delivery. So our technologies especially in a dry blood spot field, can be leveraged beyond newborn screening. So that's one message I want to deliver today. So if we think about the sample collection matrix, the dry blood spot matrix is a key, because ease of collection and ease of shipping dry blood spot sample drives the cost effectiveness in population-wide screening programs. And our extensive experience and know-how in newborn screening and laboratory infrastructure we built almost all of the European countries and globally uniquely positions us to support public health initiatives aiming to detect type 1 diabetes at its preclinical stage. And we all know that roughly 90% of new type 1 diabetes cases occur with no family history. An existing genetic risk score may overlook children who develop type 1 diabetes later in life. So therefore, identifying children in a general population using autoantibodies at age of 2, 6, or 10 presents a very promising screening strategy. We also heard today that to achieve a true success in type 1 diabetes screening, all components, education, screening, follow-up, treatment, long-term care, everything needs to be interconnected. And at Revvity, we are committed to train healthcare professionals to ensure the accurate implementation of our technologies, minimizing the risks and reducing the false positives and false negatives. Screening is, without a doubt, the gold standard of preventive healthcare. And together with our partners, we are united in impact, embracing impossible to improve the lives of children with type 1 diabetes in Italy and across Europe. So we are here today to encourage policymakers, including members of European Parliament, to consider incorporating early childhood screening for type 1 diabetes into existing newborn screening programs or other preventive health measures. Revvity stands as your partner in this journey. We are committed to developing the solutions and technologies that address the greatest health challenges of our time, the burden of type 1 diabetes. And now I wanted to take a moment and extend our sincere gratitude to Professor Vincenzo della Renci and Professor Damiana Pieragostino from University of Chieti for helping us with developing dry blood spot Delphia-based autoantibody assay and publishing the very first paper using dry blood spots for early detection of type 1 diabetes. Thank you so much. To conclude, I want you to remember that dry blood spot samples are easy to collect. Automation and central laboratory model drives cost effectiveness in population-wide screening programs. At Revvity, we are dedicated to building necessary capacity for nationwide type 1 diabetes programs in Italy, throughout the Europe and beyond. I urge all key stakeholders to join us and fight against type 1 diabetes. Together, we can make a meaningful difference in lives of so many children. Thank you.